my name is Melissa Jarrett. I'm an Indiana State University nursing student, and I have prepared a presentation for chlamydia in newborns, community awareness and screening for prevention. Before we proceed into the presentation, please take a few minutes to actually complete the pretest. You can utilize the link found here simply by holding down the control and clicking on the link below. The learning objectives for this presentation are 1. To define chlamydia, 2. List factors that contribute to chlamydia in the community, 3. Identify method of transmission from mother to baby, 4. List the risk of chlamydia infections to newborn baby, 5. Identify community resources for screening and treatment for chlamydia, and 6. List the preventative measures to lessen transmission of chlamydia in the community. What is chlamydia? Chlamydia is caused by the bacteria Chlamydia trachomatis. Chlamydia is the most common sexually transmitted infection in the United States. According to the CDC, it can cause cervicitis in women and urethritis and proctitis in both men and women. Chlamydial infections in women can lead to serious consequences, including pelvic inflammatory disease, tubular factor infertility, ectopic pregnancy, and chronic pelvic pain. Who is at risk? According to the CDC, in 2018, 1 in 5 people in the U.S. have a sexually transmitted infection. Those at highest risk for chlamydia are identified as follows. Youth aged 15 to 24 years, especially young women aged 14 to 24 years. Non-Hispanic blacks have 5.6 times the risk as compared to non-Hispanic whites. Men who have sex with men are at risk for rectal infection and pharyngeal infection. And maternal infant transmission occurs in 23 to 70% of infected mothers. Transmission of chlamydia. Chlamydia is transmitted through sexual contact with the penis, vagina, mouth, or anus of an infected partner. People can be reinfected after treatment if they are exposed to an infected individual through sexual contact. It is the recommendation of the CDC that any individual exposed to chlamydia be retested 90 days after completing therapy to ensure reinfection has not occurred. All sexual partners will also require testing and treatment. Symptoms may be very mild, and many people are unaware of the infection. Up to 50% of affected men and 75% of affected women have mild or no symptoms at all. Chlamydia can also be spread perinatally from an untreated mother to her baby during childbirth, resulting in ophthalmia, conjunctivitis, or pneumonia in some exposed infants. In published prospective studies, chlamydial conjunctivitis has been identified in 18 to 44%, and chlamydial pneumonia in 3 to 16% of infants born to women with untreated chlamydial cervical infection at the time of delivery. Signs, symptoms, and complications associated with chlamydia are as follows. For women, you can suffer from cervicitis, which includes a purulent discharge and endocervical bleeding. This is bleeding with sexual intercourse or outside of the monthly period. Urethritis, with pyuria, the presence of purulent drainage in the urine, dysuria, pain or burning with urination, and urinary frequency. There may also be complications like pelvic inflammatory disease, which includes, but is not limited to, abdominal pain and tenderness, infertility, and can lead to ectopic pregnancy. You may also have complications in pregnancy associated with chlamydia and can include preterm delivery. In men, you usually suffer from urethritis, which includes a watery urethral discharge, dysuria, pain and burning with urination, and it may lead to epididymitis, which includes testicular pain, tenderness, and testicular swelling. Signs, symptoms, and complications that can include both male and female are as follows. Conjunctivitis of the eyes. You'll notice a discharge lid swelling, irritation, a foreign body sensation, redness, enlarged preauricular lymph nodes, papillary follicular conjunctivitis. Scarring and damage to the cornea can lead to decreased visual acuity and/or eventually blindness. And of course, rectal signs and symptoms may involve pain, discharge, or bleeding. Signs and symptoms of infection in newborns. Newborns will present with conjunctivitis as the most common sign and symptom. They will have nasal lacrimal duct and nasopharynx infection. And if unresolved, the drainage can cause chlamydial pneumonia. The signs and symptoms of pneumonia include a staccato cough, tachypnea, chest infiltrates, and unresolved pneumonia will lead to risk for reactive airway disease. Treatment recommendations as presented by the World Health Organization are as follows. For uncomplicated genital chlamydia, azithromycin 1,000 milligrams orally in a single dose or doxycycline 100 milligrams orally twice daily for 7 days may be administered. For anorectal chlamydial infection, doxycycline 100 milligrams twice daily for 7 days is the first line treatment, followed by azithromycin 1 gram as a single dose. For chlamydial infection in pregnancy, azithromycin is recommended over erythromycin amoxicillin. Azithromycin 1 gram is given as a single dose, or amoxicillin 500 milligrams orally 3 times daily for 7 days, or erythromycin 500 milligrams orally twice daily for 7 days. Doxycycline is contraindicated with pregnancy. Infant disease, they will receive erythromycin 50 milligrams per kilogram by mouth, 4 divided doses for 14 days, or azithromycin 20 milligrams per kilogram by mouth daily for 3 days. Prevention interventions for the community can include the following. Provide education to all young adults within the 15 to 24 year range. Incorporate sexual health into schools and give girls discrete resources for testing and treatment. Parental education through use of Planned Parenthood and local physicians' offices will need to be included. All young people and adults should be tested annually if sexually active or if they have multiple sexual partners. Target group should include ages 15 to 24, and post-exposure and treatment testing should occur 90 days post-treatment to verify that reinfection has not occurred. All partners of confirmed positive patients should be treated and tracked to the local health department. Compliance can be increased with use of grant funding for prevention. Pregnant women should be screened for chlamydia at their initial visit to a provider for signs and symptoms. Anyone identified as high risk, such as those with new or multiple sex partners and those under the age of 25, should be screened again during the 3rd trimester. Those mothers with no or very little access to prenatal care are screened for chlamydia upon admittance into the hospital. Test and treat any possible affected mothers for prevention in newborns. And newborns born from an infected mother are monitored to ensure infection does not develop, as treatment with antibiotics to prevent infection is not recommended. Community resources include those resources that provide free testing and treatment to any and all patients. The Centers for Disease Control provide both education and the CDC Get Tested website, as seen here. Planned Parenthood will also help you to find a local clinic or a clinic designed for free testing for STIs. And then you have the CDC Health Department directory, and you can find your local health department simply by clicking on the link and choosing your city and or county that you live in. We have now reached the end of the presentation. If you would take a few minutes to complete the post test located simply by holding down the control key and clicking on the link below.